All right, welcome everyone. I'm going to go ahead and get started. We've got a lot of good information to get through today. My name is Angelina Alpert. I am a research assistant at the University of Missouri Kansas City Institute for Human Development, and this is our Missouri Open Door Workshop Benefit Series. And today's topic is going to be Medicare 101. Right, so this workshop is sponsored by the Medicare Improvements for Patients and Providers Act, which is also known as the MIPA grant, priorities 1, 2, and 3. So that'll be CLAIM, Missouri Department of Health and Senior Services, and UMKC, Institute for Human Development, which is the No Wrong Door grantee for the state of Missouri. So just a little bit about Missouri No Wrong Door. The goal is to transform the way people access services in the community. So we want to support individuals and caregivers to make decisions on complete and accurate information about their options for anyone seeking long-term services and supports, regardless of age, income, or disability. So the goal of our Missouri Open Door workshops are to open doors to integrated supports. So if you are familiar with our other Missouri Open Door technology series, those focus on the technology part of the STAR. And the goal of integrated supports is that sometimes the services that a person accesses cuts them off from their family and their community and doesn't let them live that good integrated life in the community. So the goal of these workshops is to help individuals learn about their other integrated support options. So we have personal strengths and assets, which are anything that a person has, like their skills, their strengths, things that they're good at or others like about them. Relationships with family, friends, or acquaintances. Eligibility specific, which are going to be needs-based services. And those are also government services. And so those are the types of services that we're going to cover in this new series. So we are going to start with Medicare, and they are going to have the first couple of series through October. So this is the schedule for that. Those will be the second Wednesday of every month from 12:30 to 1:30. And then our other technology series is going to be the fourth Wednesday of every month from that same time. And we hope that you will join us and you will learn some good information about integrated supports. And I'm going to go ahead and pass it over to Clayton.
Well, thank you all for being here. My name is Scott Minion. I'm the Executive Director of Missouri Connection. And as such, that means I'm also the Executive Director of the CLAIM program, which is Missouri's State Health Insurance Assistance Program, which in shorthand means we help Missourians across the state with their Medicare benefits. And so this is the first of a series. We're very excited. We are also part of the MIPA project, as Angelina shared. We are MIPA Priority 1, which is the MIPA project that is administered through the SHIP program. And so I just very, very quickly, we provide a variety of different services around Medicare. But if it touches Medicare and you're a Missourian in general, we're people who can help you, and we don't sell or give biased information. We are federally funded through the Administration for Community Living, just like the Open No Wrong Door and all of the series that you're talking about here. We are here to help, and we cover the entire state. So Gary will talk about how we can help in a variety of ways. And just to introduce, this is Medicare 101, but our Medicare 101 is broken over several editions of this workshop. So this is just the first part. And Gary will be your presenter, and he's very ably doing so from his Kansas City area office. And we're based in Columbia, but we've got folks all around the state. So with that, I'll let Gary and Sonia take it away with whatever they need to do.
All right, thanks, Scott. Okay, so what we're going to cover today, and again, we're kind of at the 50,000 feet level today because Medicare is a pretty complex beast, and there's a lot of ins and outs to it. So we're just going to kind of keep it at a high level. And as we go through the slides, I know you'll have some questions. Probably best, since we're on an hour kind of a time frame, if you could kind of hold those questions, be writing them down for the end. And the time that we have there, we'll address those questions, and I'm happy to stay after the hour if need be to help answer questions. So I don't want you to feel like your questions won't be answered, but we're going to go over the eligibility and enrollment for Medicare, just the program overview, talk about Medicare supplements and Advantage plans and prescription drug plans. So as Scott said, there's other topics like Medicare savings that we'll get into further on into the series. But for today, we're up a level. And Scott touched on this a little bit. I've been a counselor for 5 years, as well as part of the strategic outreach team for Claim. All the things that you see on the screen here, I know personally I have been able to help people with that. So, but I tell you, if I was looking at these, the prescription drug program, doing plan comparisons, talking about Medicare Advantage plans and the enrollment and billing, that's probably the top 3 items that at least me personally have helped Missourians with their Medicare. So let's start off by what is it? You see over there on the right, the red, white, and blue card. That's the kind of the passport for Medicare, if you will. And it's very important. And it's interesting when we talk to people, we'll say, hey, do you have your Medicare card? And they'll say, well, I've got something with my social security number on it. And we say, no, that used to be the Medicare number. Now you have a red, white, and blue card with a Medicare number on it. That's not your social. That's what you see over there at the right. So, I mean, Medicare is a health insurance program really for people 65 years and older. For the most part, that covers it. In the US, I think there's about 62 million people on Medicare. In Missouri, I think that number is probably around 1.2. Scott's always got a running tab of that. But a lot of people on the program, if you're under 65 and have been disabled on SSDI for over 24 months, you too are eligible for Medicare. So that's another way. The first is aging into the program, the 65 and older. And the other way is really the 65 with disabilities for over 24 months. Also, end-stage renal disease or ALS also gets you into the Medicare program. So it's a little confusing, and we'll talk a little bit about it on future slides, but the program is administered by the Centers for Medicare and Medicaid Services. But in order to get started with Medicare, you enroll through Social Security or the Railroad Retirement Board. So that trips people up a lot on how to get started, but we're going to go through that in detail. So, you know, I talked about Medicare being a little confusing and complex. As you see on this slide, there's a lot of different components of Medicare. And if you, at its highest level, when we tell people to kind of ease their concerns about there's so many plans and, you know, all of this, I don't know what to do. At the highest level, there's 2 ways to get your Medicare. So that makes people feel better. So original Medicare, or sometimes it's called traditional Medicare, same thing, is on the left-hand side, and then Medicare Advantage plans are on the right-hand side. So that's at the highest level, 2 ways to get your Medicare. And so that's your first choice. So original Medicare is going to be managed by the government. The Medicare Advantage on the right is managed by private insurers and plans sold through private insurers. So that's at the highest level. That's kind of the differences between original and Medicare Advantage. A lot more lot more differences that we'll go through. But at this point, I just kind of wanted to go through, starting on the left with original, Part A and Part B. And again, we've got future slides to address some of these, but your hospitalization and your doctors for Part A and Part B. And then after that, you've got some optional things that you can add with original Medicare. You can add a prescription drug plan, which is Part D. You can add supplemental coverage, which is also called Medigap, or you'll hear it called Medicare supplement as well. So different names for the same thing, because Medicare pays 80% and your coinsurance is 20%. That's kind of the way the system works. So the need for supplemental coverage can come in handy as well. On the right-hand side, and I should say before I jump to the right, when you add different components like Part D and the Medigap or Medicare supplement, those are additional premiums products that you are buying as well. So, and we'll get into the cost for each one of these. Medicare Advantage, as I said, that is sold from private insurers. Those plans change every year. It's kind of like what the internet and TV companies have done. They like to bundle your TV and internet and phone all together in one nice package, and you pay one bill. It's kind of the same way with Medicare Advantage. They bundle your Part A, Part B. Most of the plans bundle your drug plan, the Part D as well. And they provide some extra benefits like vision and hearing, dental as well, all in one nice kind of wrapped up package. So again, at the highest level, original, government run, Medicare Advantage, private insurer run. Okay, Sonia. So Part A that we just talked about, and you've got Part A on both sides of that ledger, is really think of that as your hospital inpatient care, medical, psychiatric, skilled nursing, home health, hospice, blood transfusions. And the cost for Part A, for the majority of people, it's premium free. And when I say premium free, you have to have worked 40 quarters of employment. You or your spouse have had to work 40 quarters of employment and paid into the Medicare system. So most people have done that. And so for most people, Part A is premium free, which is nice. Okay. Part B is really think of that as your doctors. When you go to the doctor's office or ER, urgent care, outpatient, durable medical equipment, things like that, those really fall under Part B. And so Part B, again, for your doctors, most of these will have co-pays for your doctors as well. But that's Part B is the doctor component of your Medicare. Okay. And the cost for Part B, as I said, Part A was premium free for most folks. Again, most people pay $164.90 in 2023. They adjust the premium each year for Part B premium. Last year it was $170.10. This year, $164.90. And so when I say most people pay that, if you're a higher income wage earner, there's something called IRMA. And if you're single and make over $97,000, you pay a higher premium than that $164. Married, $194 is kind of the first tier. And as you go up that income scale, the premium increases. So there's different strata for that on Part B. On the reverse side, there are some people, and again, that's a different series, where they're lower income and there are Medicare savings programs that can help eliminate that $164.90 if they can't afford it. So, but again, that's the next series. Most people just opt to have the premium taken out of their monthly Social Security check, or direct deposit, if you will. That's the most effective way. That's what the vast majority of people due. And, if you are taking Social Security benefits as you turn 65, you'll automatically be enrolled in Medicare. And we'll talk about that in a minute. So if you aren't on Social Security benefits yet, you'll get a bill every 3 months for $494.70, or you can do easy pay for monthly payments. So there's different ways that you can be billed and take care of that if you don't have it taken out of Social Security or you haven't started those benefits yet. So the costs, there is an annual deductible for Medicare Part B. And again, we talk about Part B relating to outpatient and doctor for the most part, $226 in 2023. And again, that amount changes each year. And 20% of the Medicare approved amount is what you would be responsible for. A few terms, assignment. So when you go to a provider, that provider may take Medicare assignment. It may be Medicare non-assignment. So basically, if they take assignment, Medicare assignment, they've agreed to accept the Medicare approved amount as full compensation. They can't charge you anymore. Non-assignment, they say, well, I don't have to take what Medicare says, and I can bill you for at least 15% more than what Medicare allows, which you would be on the hook for at that point, called excess charges. And critical access hospitals, if fewer than 25 or fewer beds, the 20% co-insure might be based on a higher amount than it would in a larger hospital. So, but for the most part, it's a fairly low deductible, the $226 a year. Really a pretty good.
What do you find? I'm just starting this. How often do they accept the assignment? And are most, is that the standard?
Yeah, you broke up.
Most of them non-assignment.
Yeah, you broke up a little bit, David, but I'll take a shot at it quickly. And the majority of people take assignment. And I say majority, I don't have stats, so I need to be careful. But in talking to people, most of the time they agree to take the Medicare approved amount for their compensation. It's just something to look out for, something to ask. As a consumer, you need to ask that. So that's,
thank you.
Yep. Okay, Sonia. So how to enroll? We talked about if you're taking Social Security benefits, say you decided to take it at 63, you could start taking Social Security benefits at 62. You waited and said, okay, I'm gonna do it at 63. You're taking those benefits. When you turn 65, or actually probably 3 months prior to that, you'll automatically be enrolled in Part A and Part B for Medicare by the Social Security Administration without doing anything. You don't have to accept it. You can turn all of it down. You can turn Part B down if you have other insurance that you have and you don't want to pay that $164.90 premium. So you've got options, but for convenience sake, if you're taking benefits, they assume that you're going to want to be on Medicare A and B when you turn 65. If you don't take benefits when you 3 months prior to your 65th birthday, you can enroll in Medicare, and it'll be effective when the birthday month of your 65th year. You can do it through ssa.gov, which is a great way to do it. You can call as well, Social Security Administration. You can also go into the offices, but the most effective and time effective method is really the ssa.gov. If you're a retired railroader, you've got a system totally unique to your career, and the railroad board actually signs you up for Medicare. So there's a different process for that. Okay, Sonia. So when to enroll? We talked a little bit about when you turn 65. It's kind of a 3-1-3, kind of a way to remember when you can enroll. You can enroll 3 months prior to your 65th birthday month. Then your birthday month is the 1, and then 3 months after your birthday month. So that's your initial enrollment period. You can, enroll then. Don't have to worry about any penalties or anything like that for late enrollment. We talked about the automatic and being able to opt out. And, when you enroll depends on when your coverage starts. So what I tell people is, and you can pick an effective date as well. So I tell people when that 3 months before, utilize that time frame to kind of look over your material, kind of be thinking about which way you're wanting to go, Advantage or Original, and be ready to go. So if you sign up when you turn 65 or during the 3 months after, the next month is when after you sign up is when your coverage is going to be effective. So that's a change from a prior year. Okay, so there are some individuals, and it seems like that's more and more this day and age, and this is a common question that we get, is they're saying, hey, I'm 65, but I'm assuming I'm going to work for another 5 years, and I've got good group health insurance, and so I really don't want to pay $164 a month for duplicate coverage or similar coverage. I just as soon wait, but I don't want to be penalized. And so there's something called a special enrollment period that accounts for this. So it's saying if you've got credible coverage from your employer, group coverage that's for active employees, that's fine. When that ends, you've got a special enrollment period of 8 months to get on Part A and B and 63 days for Part D. So again, when you're going to retire, typically there's plenty of time, but you've got a good special enrollment period if you chose to wait to enroll in Part B. A lot of people will go ahead and enroll in Part A because it is premium free for most people at 65. And then they'll just enroll in Part B, which has that premium when their employer coverage ends. So there's different strategies for doing this. But again, it's something that we're seeing more and more because a lot more people are working past 65 these days. So if your employer has a health savings account that you're contributing to, you need to discontinue contributing 6 months prior to your Medicare enrollment if you're older than 65. Basically, there'll be tax ramifications if you don't. That's the why behind why you need to discontinue that. So the IRS doesn't like that if you're participating and contributing and the company's matching and that sort of thing. So, I talked about active employment a little bit ago with your group health plan and you're working past 65. It does matter that it is active employment. It can't be retiree employment or retiree coverage. You can't be COBRA. Those aren't considered active employment insurance by Medicare. So if you want to avoid the penalty, it has to be active employment. And the number of employees does matter. And I always tell people that bullet down at the bottom, check with HR when you're dealing with Medicare and group health to make sure, the number of employees and how they see Medicare and the group health plan playing nicely together, not playing nicely together. If there are less than 20 people, it's really important that you do some checking because if we'll go ahead and go to the next slide, Sonia, before I start talking about this, and we'll do that. But again, we're talking about Part B coverage, optional under the active medical or the spouse's active medical. I should have mentioned that. So, who pays first? a company has to have 20 or more employees for somebody 65 or older for the employee plan to be primary. So if you want your group health to be primary, you have to work somewhere that has 20 or more employees. So that's something to consider. If you have less than 20 employees, Medicare is going to be primary. And so you really need to make sure that you sign up for parts A and B if you have fewer than 20 employees in your company, because you can run into the situation where Medicare would have been the primary and you go in the hospital and they would expect Medicare to be the primary and pay, but you didn't sign up. And so your group health wouldn't pick up the vast majority of the bill. So that's something very important to keep in mind. Okay, Sonia. So again, this is very similar, just talking about employer union coverage ends. So you got that 8-month special enrollment period to sign up without a penalty. And you do have, timeframes, prescription drug, 63 days to get that in place, and some of the others. So we will talk about that in a little bit. Okay, Medigap. If you go back in your mind's eye to that slide that showed original Medicare and Medicare Advantage on it, one of the optional items with original Medicare, and again, it's original Medicare only, does not apply to Medicare Advantage, is a supplement, again, or it's called Medigap. And it does work with Medicare Parts A and B. And we talked about your coinsurance being 20% with Medicare. So Medicare supplement's designed to help you with those out-of-pocket costs, whether it's your deductibles on your plan, co-pays, co-insurance. So if you're a person that doesn't like surprise medical bills when something happens, a Medicare supplement might be a good plan for you. They're sold by private insurers and really designed to cover that 20%. And they also can cover things like foreign travel insurance as well, to handle some medical expenses for those as well. But a lot of people get this, and what they typically tell us as counselors is, hey, if I go in the hospital, I want to come out without a bill. And there are certain plans, certain Medigap plans that will do that. They'll handle all the deductibles as well as the co-insurance. So they like knowing that if I pay a premium for a Medigap plan to a private insurer, I don't have to worry about, a big deductible that might come my way if I get sick. So that's what they kind of like. The service has to be covered by Medicare for Medigap to come into play. So original Medicare does not cover things like dental procedures or hearing aids or vision. And so even if you have a Medigap, it wouldn't pay on those types of items because they weren't covered by Medicare to begin with. So there's 10 Medigap plans. And again, that's why people get kind of overwhelmed at the first, again, going back to that original slide, even though there's 2 choices to get your Medicare, within that, there's 10 Medigap plans to choose from. There could be 30 to 40 drug plans to choose from. There could be 30 to 40 Medicare Advantage plans in a year to choose from. So that's where it gets confusing and overwhelming for people. And that's where, as counselors, we can help them wade through that and do the analysis to kind of show them their options. Okay, Sonia. So in order to get a Medigap, first you have to be enrolled in Part A and Part B. One of the important things with Medigap is the Medigap open enrollment period. Typically a one-time opportunity for 6 months, and it coincides when your effective date for Part B, your doctor's portion of Medicare, goes into effect. And so at that point, you get guaranteed issue rights, which is very important because at that point, when it's guaranteed issue, it doesn't matter what health conditions you may be experiencing or have experienced, whether that's been cancer or heart problem or whatever, doesn't matter. The company can't turn you down. They can't ask you medical questions. They can't charge you more premium than they would for any other person your age when you come into the Medicare program. So that's a great benefit. And so they have to honor that. And again, the no underwriting is great. If you do outside of your open enrollment period, then kind of all bets are off, and they can do underwriting. They could charge you more. They could say, I don't want to write you, you're at risk, I don't want to write. And so that's why we tell people this is a great time if you're considering a Medigap to get it, is in your open enrollment period, that 6 months that coincides with Part B. You know, and I said most of the time it's a one-time opportunity. If you're in the Medicare program because of you've been disabled for over 24 months, when you reach 65, you'll also have another open enrollment for Medigap. So you'll actually have a second open enrollment when you reach 65 if you've been disabled on Medicare. Okay. You know, one of the things that we tell people is, you know, the premiums, your premiums will go up as the years go by just because of inflation. So companies have different methods for their increases. You know, some will increase their premiums each year, some every other year or every third year. So it just depends on the carrier. But you continue to pay at the rate for the age you first purchased the policy. But again, at the end of the day, you kind of look at it and you go, wow, my premiums are going up. I thought that was not supposed to happen. They still let the companies increase the premiums for inflation. So one of the things to keep in mind with a Medigap, and it's kind of an important one, is I talked about there being 10 different plans for Medigap, and they all have a difference in coverage for what they cover, how much they cover. Some cover everything, some might cover a percentage of the coinsurance that you have. The good thing from a consumer standpoint is every company based upon that plan has to offer the same benefits. So if you get a plan G, which is kind of the Cadillac plan for Medigap, that plan G has got to have the same benefits regardless of the company selling that plan. Now, they can all have different premiums, and that's where I would caution you to do some price shopping when you look at a Medigap, because there will be a wide variety of prices for the same benefits to the individual. And once you choose your plan, if you want to maintain your guaranteed issue and renewal, you need to stay within that same plan letter. Otherwise, you have to go through underwriting again if you change plans. So each year, 30 days prior to and 30 days after your anniversary, policy anniversary date for your Medigap plan, you can shop different companies within that offer that same plan. And if there's a better price, you can opt to select that same plan with a different carrier, and you still maintain your guaranteed issue and guaranteed renewal without underwriting. So that's a big benefit. So Missouri is one of the few states that do that. Okay, we're off to prescription drugs, Part D. D is in drugs. So again, if you think of that left side of the figure that we talked about, Part D is optional, but without it, you don't have drug coverage. So it's kind of an important thing to do. Each company, again, this is private insurers, offer these Medicare drug plans. And each year, That's some of what Claim does is we help people during open enrollment, October 15th through December 7th, to analyze their prescriptions, analyze all the plans. And again, there could be 30 to 40 prescription drug plans in your area. And we help them do the analysis to see what's the best coverage for them based upon their current prescriptions. And again, it's not automatically enrolled and it's an optional feature. One thing that I will mention is with Medicare Advantage, and it'll come in a slide a little later, typically the drug coverage is included with your Medicare Advantage plan. Not always, but typically. So the plan finder on Medicare Gov helps you do that analysis, which is great. We tell people they need to do it every year, even though their prescriptions may not have changed, because the formularies for the insurance companies may have changed, and they may have moved one of your meds from a tier 1 to a tier 4 drug. And so the price would change. So it's always good to look and compare each year to see if there's a better plan out there for you. Okay. So the initial enrollment, same as original Medicare. Special enrollment, we talked about, you've got 63 days from that qualifying event, like a loss of your group health insurance, for instance, or if you move out of the current plan coverage area, you've got a special enrollment that says you've got time to pick up another plan, and you can read all of these. Maybe you've lived in Europe for a while, you're coming back to the US. If you're low income and been on extra help, or just approved for extra help, you've got the ability to change drug plans as well. So there are different events, different life events that give you special enrollment periods that you can use to qualify to enroll in a drug plan outside of the initial enrollment period. So if you fall in one of those, then you've got a way to get in outside the initial enrollment period. So what does it cost, prescription drugs? Well, just like everything, it varies by plan. The national average is around $32. I would say, I think this year, maybe the lowest was around $7 a month. Highest I saw, I think, was maybe 101, something like that. So that's kind of a range. Typically, the higher dollar amount monthly premiums will have a lower deductible. But as we looked at the majority of the plans last year, or I'm sorry, this year, have about a $505 that max deductible attached to them. So you need to pay the $500 before you get the full benefit of your plan. And the co-payments and co-insurance may apply depending on what tier you're in. There may be some drugs that are provided at no additional cost, no co-insurance, and then others have a co-insurance. So that's why going through the plan finder and looking at all the various plans and prices is important. A biggie is insulin's been capped at $35 a month. That's a great benefit. That used to be, we would run into a lot of people that would just say they couldn't afford their insulin and they wouldn't take it, or they would take half of as much as they were supposed to because they couldn't afford it. So it's a big benefit that now the insulin's been capped at $35 a month. Okay, late enrollment period, or penalties, sorry. If you wait and don't enroll into a Part D plan when you're first eligible, and you don't have credible coverage through your job, through your group health insurance, your premium is going to be higher when you enroll at a later date. So they assess a 1% per month penalty times that national benchmark, which was $32, for the time that you're without coverage and you could have had it. So that's something to keep in mind. So when people say, hey, I'm not on any scripts right now, I don't want a drug plan, and I don't have a credible drug plan either. Typically we say you might consider joining a very inexpensive drug plan like the $6 drug plan a month. That way you cover, you don't have a late penalty, and if you need a script in the middle of the year, you've got coverage. Okay, Sonia. Okay, kind of the last segment here, Medicare Advantage. And again, so now we're in your mind's eye, go to the right side of that original document, and you're on Medicare Advantage. Sometimes it's called Part C. So again, it seems like everything has two different names it goes by, but most of the time it's Medicare Advantage plans. These are private health insurance plans with companies that have contracted with Medicare. So this could be an Aetna, this could be United Healthcare, that type that puts together a plan, much like what your group health insurance might have looked like. So much to go see your doctor for a copay and different co-insurances. But again, they include the benefits that are in Part A and Part B, so that part doesn't change for you. Whether you do original or Medicare Advantage, those same benefits need to be covered under an Advantage plan. Some Advantage plans have a premium associated with them. Many don't. I was going to say the vast majority, but anymore it seems like the premiums have are closer to zero than they are anything. So that's been a good thing for consumers. But again, each plan can be different. So the fine print is really important to look at in these. And as you're going through and deciding, and again, I'm not going to go to it in great detail because there's another session coming up later on in the series. But what I tell people is make sure that you can go to the doctors and hospitals that you want to go to. That's kind of the first, number one priority is, can you see the doctor that you normally go to? Are they in network? And so that's kind of where we start off with Medicare Advantage and counseling people is, let's make sure you can go to who you want to go. Don't worry about silver sneakers and you get free gym membership. First thing to think about is, can you see who you want to see? The nice thing about Advantage plans, they do include some benefits for basic dental, vision, and hearing, which original Medicare does not. And so, for instance, they may have a $1,000 cap on basic dental procedures. So your x-rays, cleanings, office visits, up to $1,000, they may have a benefit like that. Some may be higher than that, some may be lower. And again, similar to vision and hearing. So read the fine print on a Medicare Advantage plan. Okay, Sonia. So you have to be enrolled in Medicare Part A and B to be eligible for a Medicare Advantage plan, and you have to live in the coverage area. Well, makes sense. So the 15th through December 7th, you can enroll in a plan. It would be effective come the 1st of January. And you can switch Medicare Advantage plans each year during the open enrollment. If you decide you looked at one and you enrolled and you didn't like it, next year you can go to a different one, or you can roll back to original Medicare. And we'll talk a little bit about that on the next slide, I believe. So you get one change if you're already on a Medicare Advantage program during January 1st through March 31st. And again, you can switch plans. That's great. And so the common question people have is, hey, am I stuck on an Advantage plan if I start out with that? And no, the answer is you can roll back to an original Medicare and you can enroll in a Part D plan as well. So you've got the option to do that. And again, the changes affect the first day of the month. You're not locked in, but there are limitations that we'll talk about. So the nice thing, one of the kind of outs that I'm talking about is the trial period. So if you're 65 or older and you enroll in Medicare Advantage for the first time, it begins a one-time 12-month trial period where you can go back to original Medicare and Part D. You can do the Medigap with the guaranteed issue during that first 12 months. So if you get on Medicare Advantage and you say, wow, I'm having trouble because the company's pushing back on procedures I need to have. I think original Medicare might have been better. Or the doctor that I now want to go to isn't accepted by my Medicare Advantage plan. And I want to move back. You know, that buyer's remorse, if you will, you've got a way to get back to original Medicare with the Medigap, with guaranteed issue during that first 12 months, which is great. So that is a very big benefit, if you will, to if you want to dip your toe in the water, but still want to have a backup plan. This is your backup plan. So again, kind of to close out on Medicare Advantage, before you enroll, like I said before, make sure you can go to the doctors and hospitals and labs that you want to go to. That's probably one of the most important things. Make sure that the drug coverage that's included with the plan, again, we talked about it kind of being like your internet provider. It kind of rolls everything into one, your hospital, doctors, and prescription drugs. Review that coverage to make sure that that's acceptable to you. Understand the cost shares, because those will vary from plan to plan, company to company. And don't assume the extra benefits are unlimited. So sometimes on TV with, you know, the old Joe Namath or JJ Walker or whoever the celebrity spokesperson is for the Medicare Advantage, you know, they talk about, hey, you get free dental and you get this and that. Again, typically there are limits on what you can use those benefits for. So for instance, if you had a crown or a root canal, that may not be covered at all. It might just be routine dental work, not fillings or not crowns or not root canals that are covered. So if you switch because you think it'll pay for your root canal, you just need to review the plan details and figure that out. And again, SHIP counselors can help with that as we work through those things with people. And finally, one of the great tools out there is Medicare Gov. And they have the ability to have a portal for each Medicare beneficiary. And from a counselor standpoint, as well as a beneficiary standpoint, it is essential to be able to see what plans you're on, what the benefits are, what your claims have been, your different notices, replacement cards, claim status. It's all out there. And so as counselors, we sign a lot of people up and set up their Medicare Gov account for them to be able to manage their health cares. So that's great. So again, that's a good place to go. A lot of times people, you'll ask them a question about what coverage they have, what plan they're on. They won't have any idea. And so if we can get them on Medicare Gov, then we can see exactly what Medicare says and validate that. Okay, save the dates. We talked about kind of the Super Bowl being October 15th through December 7th to review your coverage, get in a plan Part D, enroll in a Medicare Advantage, change your Medicare Advantage. Again, add coverage. It's a great time to do that. On a Medicare Advantage, if you have one of those plans, you've got an open enrollment through, you know, the 1st through the 31st of March to do that, or you can return to original Medicare, add your Part D. So, and again, we talked about when the enrollment was for Medigap, so we won't go through that. But and then just a quick slide that says join our team. We're always looking for counselors. We talked about the number of Missourians on Medicare being 1.2. There's a lot of people that need help, and we would love to have more help as we go. So that's kind of our pitch, if you will, to join our team. So And I have no idea where we're at on time, so let me look quick. Looks like we have maybe a few minutes for questions.
I will mention there's a question in the chat about things to hand out to clients that you serve. We have these palm cards with our information on them that explain, whoops, that one's the Spanish language one. We have those two, Spanish and English, that have our phone number to the call center, which is the same number whether you're calling to ask about volunteering or to say, I would really like to get a one-on-one counseling session set up because I'm either aging in. If you are a provider type, meaning you're on the call because you work with clients that may have a need for this information, we do have these palm cards available in bundles of 50 or a smaller amount. If you would request them, you call that same number and say, hey, I'm looking for information to hand out and share. And we'll be happy to share that with anyone who calls in. Our call center is operated here in Columbia. There are 4 nice people upstairs right now who take the calls all day long. They will then assign you, if you're a client, or depending on your situation, they'll assign you to some nice person like Gary or Sonia or someone who's been through our training to help you with your individual needs. So I did want to jump in and just add that, and that's an ongoing thing. We're here all year round. We're really busy during open enrollment in the fall, that Super Bowl, as Gary calls it. But yeah, we're here now, and we can always take calls during the day. And then in the evening time, you can also use our website contact form and go on MissouriClaim.org and then send in your message that way or your request, and then that'll be handled the next day.
Yeah. Thanks, Scott. And Janice, I saw your note about needy meds. Absolutely. One of the things that we will do is if we look and we can't find a good plan, I mean, there are pharmaceutical assistance programs, and needy meds is one that, you know, can identify some of those plans. We also do that. We check with the pharmaceuticals to make sure they don't have an assistance program for consumers that can't afford the meds that their company manufactures. And surprisingly, some of the income requirements are actually quite generous. So you never know till you look, but we will, when we counsel a client, we will look through some of those options as well.
I wanted to just thank Gary again for this wonderful presentation, and thank you for all of Claim. And just to wrap up a couple of things, the next benefit specific series will be June 14th. They'll be going into Medigap and Medicare Advantage plan a little bit more, as well as some more specific details on original Medicare. And then our technology series is on May 24th about supporting friendships for anybody that is interested in that as well. And we thank you all for spending your time with us today.